Hi guys, welcome to today's session. The objective would be to talk about the test and explanation series that I'll be conducting. I'll talk about rationale, why there is a need for conducting this test and explanation. And then the most important thing is I will be discussing the schedule. Now, I know that you have put in your best effort as far as the current exam or the previous exam is concerned. But then I can say let bygones be bygones because if we keep on ruminating about the same thing again and again, it tends to distract us from the future aim that we want to take. And the future aim is obviously to crack the subsequent January exam with awesome marks. I would wish that all of you get 200 plus marks. And for that, the important thing is discipline. So what I would emphasize in this test and explanation part is, and that's my first message, is that the schedule part is what you don't need to make on your own. The schedule part is what I'll be giving you, and that schedule has to be followed very, very religiously. So for those who are joining in at the moment, just give me a thumbs up with respect to the audio and the visual part, and we can proceed with the core aspects. That is like we have to play the game today. Play the game implies that we have to plan and strategize. What are we going to do in the next approximately 3 months? So I'll just wait quickly for your feedbacks for the audio and the visual part. And then we can get going as far as today is concerned. So hello, everybody. I am Dr. Marwah, and I'll be conducting the FMGE test and explanation, which would be targeting the forthcoming January 2026 exam. Now, as I said, like the most important thing is the schedule. But before I come to the schedule part there, very good evening, Ashish, Mithon, Vision, Shahid Mushtaq. So I would like everybody to comment in the chat box at the moment the word pass, because when you start something, just say Hindi mein bolte Shri Ganesh karna. So today we are like, doing that. The word pass would make you like being more positive, because when you write down something that you are aspiring to do, it makes you more focused towards that particular goal. So yes, guys, quickly comment the word pass in the chat box below. That is just to re-emphasize, yes, I'm gonna get it. This is for all those people, whether it's the first attempt, whether it is your second or third, it really does not matter. What matters at the moment is, I said, only two things: discipline and schedule. So the main objective of conducting this test and discussion is, one, to identify the gaps in preparation, because see, we don't have weakness of a subject. We have weakness in subtopics. Like suppose if you put your hand on your heart and you say my pharmacology is bad, or my medicine is bad, or my surgery is bad, or my gynae obs is bad, then it's not that all the topics of that particular subject would be weak. Like lots of time in medicine, let's take up my subject, you might be good in GI tract, you might be good in connective tissue disorders, but you might be faltering in cardiovascular system and neurology. Similarly, in surgery, everybody is very good at GI surgery, but there were 2 questions on prostate cancer this time. I found a lot of people were not able to answer them. Some people were not able to identify the DJ stents, that there was one image of a DJ stent that came that time that was having an issue. So what is important is that here I'll be first focusing on those gaps in the preparation, that is the weaknesses. All of us try to study our strong subjects. We try to make the strong subject more strong. What I want you to do today is make a pledge to yourself, and that is that you will be making the weak subject strong. So suppose you put your hand on your heart and you say that, okay, sir, my pharmacology is weak, then I'll start doing it every single day. You may not be liking a particular subject. It could be any particular subject that could be weak. And yes, you could focus on this. And as far as the queries for NEET PG are concerned, I just want to say that, yeah, we will be doing it subsequently because the FMG result came earlier. So this plan was started much more earlier as compared to that for NEET PG. So yeah, subsequently we'll be doing it for NEET PG as well. Now, what I'll be doing in this would be in-depth topic-wise discussions. And what topics I'm going to be focusing on? I'm going to focus on those topics which come more frequently in the exam but are less read by students, or students are confused between 2 options. Over a period of couple of years that I've been teaching, I have got sufficient experience to understand what are those subtopics which are weak for every particular subject. So that's the main objective here, weak subjects to be focused on, and in-depth discussions. The discussions would be like something like 6 hours. So when we start in the morning, we give a test. That's what you will be expected to do. And after the test, you would not be getting display of the result immediately. You will first have to listen to the discussion. When you have listened to the full discussion at the normal speed that we are talking, not 1.5, not 2x. It is normal speed so that you can focus. And I would like all of you to take notes when I'm talking in those 6 to 8 hours when we're covering one particular subject there. I'll be putting minimal amount of breaks because see, I have said that even last week that 3 hours is the minimum amount of concentration that you need to have. Most people tend to chicken out in the first hour itself. I mean, first hour, everybody is, I'm gonna give in my best. The first 1 to 2 hours, like the fatigue factor comes in, and the third hour is like after 2 hours, I usually find that the performance tends to go down. So what we are gonna do is I'm gonna teach you concepts. Obviously, that is important. The concepts are important, but along with that is retention also. Because lots of time people say कि सर मैंने कल पढ़ा था, but मुझे याद ही नहीं है कि मैंने कल क्या पढ़ा था. No, you could have read a particular topic maybe 5 times, but you may not be able to retain that information and may not be able to apply it in the exam also. So each of these tests that I'll be conducting, they are like the future. It's like, you are preparing for battle. So you have to go in 16 steps. Those 16 steps that I'm telling you, you have to go step by step, subject by subject. And like, I'll repeat this once again for all of you who would be joining with me. I don't want you to make your own schedule. I'll be giving you the schedule. The schedule will come in your mail. The schedule will come in the app also. You have to prepare according to it. And it is not that I made that schedule randomly. उस शेड्यूल को मैंने उन लोगों के साथ डिस्कस करके जिनके 200 प्लस मार्क्स आए उनको मैंने डिस्कस किया. हाउ मच टाइम डिड इट टेक यू टू रीड PF? How much days did it take you to read ENT? So we have made it in such a fashion that in the first month we will be going like with 4 to 5 tests. Then subsequent month we'll pump it up to 5 to 6 tests. So you keep on gradually increasing your stamina. You can't start running a marathon from day one. तो धीरे धीरे हमें स्टैमिना को बढ़ाना है. So it's a guided path. जैसे मैंने बोला, guided path would mean that it's not a hand holding. I'm not doing a spoon feeding here, but I'm telling you that you need to prepare, then come for the exam, then listen to the discussion with a neutral mind and understand कि मैंने क्या गलत किया. Because in the exam also, you guys would be able to rule out options, but you would have then made some silly mistakes. I think most of the people who are having suboptimal results are not because of lack of knowledge. As I say always, it is always because of lack of application. That is one of the most important things. So first and foremost, what are you supposed to do? You can prepare from rapid revision. You can do main notes, whatever source you want to use, that is up to you. Here, this is match practice. Here, I'm not going to teach you how to bowl. You have to come and bowl, right? I'm not going to teach you how to hit a 6 or how to hit a 4, right? I'm saying go and play. So most students, they tend to read a lot. But at the same time, the match practice is missing. So this is pure, like, when I say example of cricket, what we are giving you at the moment is real-time match experience. We are giving you real-time match experience. That is what is important. So as I've highlighted, the test would be conducted strictly as per schedule. You don't need to make your own one. And then like, what is the test schedule? So we'll be starting the test at like 12 o'clock and then it would be 1.5 hour test in which you'll be having to do between 75 to 90 MCQs, can be 100 MCQs for some subjects as well. You will be getting something in the range of about 1 minute per MCQ. That's the exact optimal time that you get in the exam also. But after giving that, what you need to do is, normally when we give a test, what do? We say, chal yaar, thoda relax kar lete hain. No, after the test, the discussion is going to happen. The same time, you are going to be having an audio visual input, right? Because when you have audio visual input, what I mean by audio visual input is when you listen, you see, and you make your notes in your own handwriting, then 3 parts of your brain are getting utilized. You're all aware of the fact the most important part is obviously for memory, the temporal lobe. Then is the parietal lobe, and then is the occipital lobe. Occipital lobe is for seeing, temporal lobe is for hearing and retention, and parietal lobe is going to integrate everything. You have to send this from this audio visual input that I'm talking about. You have to send all this information into your neocortex. That is storage of information. Where does it occur? The storage of information occurs in the neocortex. So when I will make you use your parietal and temporal and occipital lobe under guidance, where we will take like, some short subjects might take 4 hours like psychiatry. But when it comes to pathology, it will go up to 8 hours also. But in that subject, it is not only that I'll teach you one-liners. I will be teaching you those clinical vignettes that are coming in the paper. as you would have seen this time, paper 1, most people had difficulty. Paper 2 was still okay, but paper 1, the pre and the paraclinical papers, or the pre and the paraclinical subjects, were the ones where like people were nervous after the paper, not before the paper. Before the paper, everybody was like बहुत आसान होगा, पर जब anatomy देखे ना क्वेश्चन, और जब वो फार्माकोलॉजी के क्वेश्चन आए मेडिसिन से लिंक होके, so those integrated approach that is currently required, where it is not that I'm reading only pharma, because earlier time we used to read drug of choice for a particular condition is XYZ and game over, right? Now what we are doing at the moment is we are going in for an integrated approach, that is we are doing medicine and pharma together. So that is the main objective of this particular discussion that I'll be conducting, that I'll teach you, okay, this is the rationale behind it, this is why the answer is for a particular question, and we will also link up the medicine aspects with it. This would help you improve your strike rates. सबसे इंपॉर्टेंट चीज क्या होती है? सबसे इंपॉर्टेंट चीज एक ही होती है, पढ़ते तो सभी हैं, नोट्स तो सभी बनाते हैं, नोट्स तो सबके पास है ना, एवरीबडी हैज प्रिंटेड नोट्स. व्हाट इज लैकिंग इज द स्ट्राइक रेट. दैट स्ट्राइक रेट विल कम विद practice, with a mentor. It's like a guided session where we are telling you, okay, that this is your strength and this is your weakness. Strength पढ़ना सबको आसान लगता है. मैं बोलूँ फॉरेंसिक मेडिसिन आसान सब्जेक्ट है, जल्दी खत्म हो जाता है. मोस्ट पीपल ट्राई टू फोकस ऑन दो सब्जेक्ट्स, उसको कहते हैं ज्यादा स्ट्रॉन्ग बनाएंगे. मैं कह रहा हूँ यार वीकनेसेस को स्ट्रॉन्ग बनाएंगे. Now, as far as the updates for the test is concerned, like you'll be getting a message on the Telegram channel also, and on WhatsApp also. I mean, you will be well informed in advance regarding the test that would be conducted. And the most important thing is you have to listen during the live relay. जब मैं लाइव बोल रहा हूँगा, लाइव रिले डिस्कशन कर रहा हूँ, आपने उस टाइम पे उसको सुनना है. Why that is important is because I see a lot of students, they decide कि यार बाद में देख लेंगे, अभी तो मैं कुछ और कर लेता हूँ. It is like shirking responsibility. You don't have to shirk responsibility. You own it up. You say, okay, man, whether I was able to achieve my target or not, that is okay. मैं आपको 16 सीढ़ियां दे रहा हूँ, 16 सीढ़ियां मेरे साथ चढ़नी है, लेकिन वो 16 सीढ़ियां जब those 16 steps that you climbing with me, then the live relay that will be happening has to be listed on the same day. If you're gonna postpone it and say I'm gonna do it some other day, किसी और दिन कर लेंगे यार, अभी तो मैं दूसरा सब्जेक्ट पढ़ रहा हूँ, it is like shirking responsibility, and वो दिन कभी भी नहीं आएगा. इट इज आज आपने मान लो 5 days के लिए आपने फार्माकोलॉजी पढ़ा, सो 5 days के बाद में 6th day को टेस्ट हो गया. Then after the test, what you're gonna do is you're gonna listen to the discussion that I'll be taking, and on the 7th day you are gonna revise your entire note and the test paper discussion that I've conducted. So you give 1 extra day for that particular subject. So something like 5 to 7 days per subject is what you will be investing with me. And like for shorter subjects, obviously the number of days that you will be given will be relatively lesser, and we might decide to combine some subjects also. So it's like a schedule that would be like which is going to be given to you in advance. And because I'm saying in advance, that means that you need to plan your studies around it, not different from it. Because if you will say that, suppose this week the test is that of let's say pathology, 31st is what we are starting. The date is, mark your calendars guys, 31st August is the date when I'll be starting. That is pathology. So for this particular week, you have to read only and only pathology only, no other subjects. And I get a lot of queries from a lot of people कि sir एक दिन में boring हो जाता है, so can I combine 2 subjects? My suggestion to you people is don't combine in the first reading. In the second reading or in the third reading, when you get more knowledge, that is when you can combine the subjects. But in the first reading, single subject, get the goddamn monkey off my back. बोले अप्रोच है, एक ही बारी में खत्म करो ना यार. एक बार पैथो करा, मेडिसिन करा, सर्जरी करा, बड़े बड़े सब्जेक्ट्स को पहले ही हम निपटा देंगे. So for those sessions which I am highlighting before you, you have to finish the theory part of it yourself. Whether you want to use your classroom coaching notes, face to face आपने किया, whether you want to use your rapid revision notes, whether you want to use your main notes, that is your call. But at the end of it, when I will be discussing questions, you need to analyze कि भाई हो क्या रहा है. मैंने नोट्स पढ़े बट मेरा क्वेश्चन क्यों नहीं सॉल्व हो रहा है. वहां पे मैं आपको बताऊंगा ये क्वेश्चन क्यों नहीं सॉल्व हो रहा है भाई, ये सिली मिस्टेक है, ये वाला जो है इसका कॉन्सेप्ट एप्लीकेशन करना होता है. सो वी हैव टू लाइक दैट इज लाइक समथिंग विच इज developed by somebody. Our reflexes are developing over time. जो muscle memory होती है athletes की, that is gonna be developing over time. So it is like a core, I would say, a hardcore discussion that I'll be taking care. And like there would be minimal breaks. There are no hard copies. You need to keep a separate register. Mark my words there. You wanna call it 20th book or whatever, that's up to you. हमारे लिए तो copy है ना एक. That register will be having explanation to all the core topics of a particular subject that I'll be discussing. And believe me, of all the students who have been listening to my test and discussions, I was earlier doing it almost for 10 years plus in a face-to-face mode. This time we are doing it in a online mode as well. So what I'm trying to say is, over these years, over the online mode that offline mode that I've been doing, when students have said कि sir last में क्या पढ़े, तो 1 week or 2 weeks before the exam they were just focusing on those summary of all the subjects that I had given them, and that was like enough to settle them across or sail them across. I'm not saying that questions would come from it, but I'm saying that those topics that I'll be discussing, those are the ones which the examiner wants to test you. Because जब आप किसी भी सरकारी हॉस्पिटल की कैजुअलिटी में जाते हो तो जो केस आते हैं उन्हीं केसेस को तो वो पूछ रहा है, कॉमन जो इलनेसेस है. डोंट गो फॉर रेयर थिंग्स, गो फॉर कॉमन थिंग्स, गो फॉर कॉमन डायग्नोसिस. लाइक इस बार भी जैसे नीट पीजी का पेपर था, तो नीट पीजी के पेपर में यार उसने प्री ऑपरेटिव और इंट्रा ऑपरेटिव मैनेजमेंट ऑफ फेओक्रोमोसाइटोमा पूछा, उसकी कोई बात ही नहीं कर रहा है. प्री ऑपरेटिव इज फिनॉक्सीबेंजामीन मैं मानता हूँ, पर इंट्रा ऑपरेटिव तो नहीं देंगे ना बच्चे फिनॉक्सीबेंजामीन. दैट विल कॉज हाइपोटेंशन, एंड पोस्ट ऑपरेटिव हाइपोटेंशन इज अ बिग डिजास्टर. Similarly, I'll give you one more example. There was a question that was asked both in FMG exam regarding a patient of CKD with anemia. I would like everybody to comment here. And he said that in this patient, for management, what would you do? Like one of the options were, would you be giving oral iron for this patient? Another was darbepoetin, that is erythropoietin, that would be given to the patient. Another one can be like RBCs that would be given. The hemoglobin of the patient was also low, something like 8. So can you comment in the chat box with respect to like which of these is the first intervention that would be done? Quickly, I would like everybody listening to the discussion. This is a common question that was asked in FMG exam and NEET PG exam. CKD patient, what is the first intervention that should be done for the treatment part so that we can manage the patient effectively? Guys, the answer is not erythropoietin. The answer is not erythropoietin. Mark my words, the answer is not erythropoietin. This is a common recall error that is happening. I agree that the treatment of choice for this condition is erythropoietin. If even NEET PG aspirants are listening to this, I think there was a lot of things going on, like, I mean, if the question says treatment of choice, I agree to that. But if you give erythropoietin in a setting of CKD where there is a concomitant iron deficiency, because it's a chronic disease, na? So there would be iron deficiency, there would be some anemia, chronic disease component also present. So the first thing that we need to give for this patient is oral iron supplementation. This question was poked up line to line from Harrison. In all the recalls that I'm saying, answer is going as erythropoietin, 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 and everybody is assuming कि यार मेरा तो क्वेश्चन सही है भाई, नंबर नहीं आए, क्योंकि जो सवाल था उसकी लैंग्वेज ही कुछ और थी. And it is not that I am like, twisting a question. Believe me, guys, I'm talking to those guys who got NEET PG rank. I spoke to those people who got 200 plus in FMG exam. They said कि sir first intervention पूछा. Some guys who got very good marks, they said sir मैंने तो देखा ही नहीं, erythropoietin मार दिया. It's okay. But still he was able to get the other questions right, which another guy might not have been able to. What I'm trying to tell you is that we have to focus on the core concepts. And in the exam, it looks like this. Believe me, guys, you check out every recall. They are saying it is erythropoietin. I don't dispute that. सही कह रहे हैं भाई, erythropoietin तो देना है because erythropoietin deficiency is there. But the language of the question was totally different. Yes, the answer would be the treatment of choice, Tony Sark. You were completely right. So the objective of this test and explanation part would mainly be that we have to focus on the core concepts. Now, all the tests that we are conducting would be following a particular schedule. This is the schedule. We are going to be starting with pathology coming Sunday. Then I'm giving you time. I'm giving you time to do pediatrics, physiology, pharmacology. You can see that in the month of September, we are doing, like I can say, if I include 31st August also, we are doing approximately 5 subjects at the moment. So I can say that I have divided those 19 subjects into blocks of 5 each. That is 5 OBG wise, like one subject, let's make it 20. So 5 into 4, and you guys are having 4 months at your disposal. सो उन 4 महीनों में आपने इस स्ट्रक्चर्ड फॉर्मेट के हिसाब से चलना है. द टेस्ट आर बीइंग कंडक्टेड. इसमें क्या है, आगे वाले में कई बार देखोगे शेड्यूल में दे माइट बी डिफरेंसेस आल्सो, लाइक सम सब्जेक्ट्स वी माइट बी गिविंग यू लेस टाइम एंड सम सब्जेक्ट्स वी माइट बी गिविंग यू मोर टाइम आल्सो. बट दीज आर द कोर. ये जो पीज है ना, पीडियाट्रिक्स हो गया, पैथोलॉजी हो गया एंड फिजियोलॉजी. नोबडी टॉक्स अबाउट फिजियोलॉजी मैन. Yeah, if the stores are adequate, we start, no, but they're usually the stores are inadequate. Now, if somebody is having a hemoglobin of 7 in India, do you think that his stores would be inadequate? Even your and my iron stores, will they be adequate? Have you ever got your hemoglobin level checked off yourself? No. Have you ever got your serum iron profile done? आपका मेरा भी, we are from, like, middle class, upper middle class. We are having we eat good amount of food, but we have iron deficiency, most of us. So somebody having CKD विद इकोनॉमिक स्ट्रेन, डायलिसिस कराना पड़ रहा है हफ्ते में 3 बारी. भैया पैसे देने हैं अस्पताल में, तो रोटी कैसे खाएगा? खाने खाने के पैसे नहीं उसके पास. उसका आयरन का लेवल नॉर्मल कैसे हो सकता है ना? चलो, आई होप विजन आई आंसर्ड योर क्वेरी. सो the subject which is hugely neglected, man, I'm gonna take a 6 to 8 hour discussion of physiology. They put up such easy questions in physiology. You need to have a 100% strike rate. 100%. Pharmacology again, like, this is like, when we do this, is gonna be a combo, guys. This is gonna be a combo, medicine with pharmacology together. So we really gonna, like, put pressure on our minds, and giving tests is important on a regular basis right from the first go. Let's say if I want to play cricket, can I learn to play cricket without actually going on the pitch, without seeing how the ball from a fast bowler looks like? How does a bouncer feel like when it whizzes past your ear? You might be using all the protection, gloves, etc., helmet, etc., but without having that feel of the ball whizzing past you, you cannot understand when to go on the front foot and when to go on the back foot and when to go on a defense. So this is match practice. That we'll be doing. And this match practice, I'm not gonna end, it's gonna be fight till the very end. So we're gonna do entire, जैसे मंदिर में परिक्रमा करते हैं ना, है ना, जैसे मंदिर में परिक्रमा करते हैं, वैसे हम 19 सब्जेक्ट्स की परिक्रमा करेंगे इस टाइम पे. 1 सब्जेक्ट इन अ वीक. बहुत ज्यादा थक गए, थोड़ा छोटा मोटा सब्जेक्ट और उठा लेना, बट ट्राई टू गेट द मंकी ऑन माई बैक. एंड मैं तो इससे भी जल्दी खत्म करने की कोशिश करूंगा, बट इट इज लाइक यू हैव टू डू 1 entire cycle with me. That 1 entire cycle of all the subjects will give you that bird's eye view. Then you can do combinations. And believe me, my message to everybody listening here is, एक बारी पढ़ो, अच्छे से पढ़ो, ध्यान से पढ़ो. Don't try to rush. Lot of you, I know, you might be competing with others, you might be listening to me in a library, you might be thinking, यार ये तो इसने एक दिन में खत्म कर लिया, some topics. मुझसे तो नहीं होता. I believe, be a slow reader, do it properly, give time to it. If you're listening to a video lecture on 2x, believe me, it's a joke. You are like not doing justice to yourself. In my opinion, more than 1.5 is not justified. भाई क्या करोगे थोड़ा सा टाइम बचा के? Invest the time in yourself. Invest the time to improve your mind power, to be able to focus for that particular long. तो कोर एस्पेक्ट इज सिंपल. एक बात है भाई, जैसे साधना होती है ना, हिंदी में साधना बोलते हैं, मेडिटेशन बोलते हैं. इट्स जस्ट दैट यू हैव टू बी एबल टू डू दिस ऑन अ रेगुलर बेसिस right till the very end, and you will be able to push yourself. I mean, you'll be able to like move on to the next side. Now obviously there are queries like how to find the T and E on the app. So I think you guys are very, very straightforward, and I mean, this is a very straightforward approach. You can straight away go and move on to the test and explanation part, and there, like, this is an orientation session that I'm conducting, and subsequently, like, we go live with all the subjects. So we go hardcore, we go ballistic, in fact ballistic, pounding on all the subjects. You will be getting the result also at the end of the discussion. When you get that result, don't be disheartened कि भाई मेरे इतने कम नंबर आए या मेरे इतने ज्यादा नंबर आए. डजंट मैटर. आपने सिर्फ ये देखना है कि भाई जो गलत हो गए वो क्यों हुए. क्या मुझे नहीं आता था, या आता हुआ गलत हो गया? मोस्ट ऑफ द टाइम द आंसर इज गोना बी आता हुआ गलत हो गया. बस उसको मिनिमाइज करना है. सो इफ यू आर गोना बी एबल टू, हाँ, 2x में तो गाइज इट्स नॉट पॉसिबल. आई मीन 2x में तो इट्स नेवर पॉसिबल टू अंडरस्टैंड ऑल्सो. सो आई थिंक दैट इज वन ऑफ द मोस्ट इंपॉर्टेंट एस्पेक्ट्स विच आई वांट टू हैंडल. So the couple of like how to enroll. So the enrollment is via the website only, guys. It's a separate program. So I just wanted to highlight that. And you can access on like multiple devices. You can listen to it as many times as you want. But in my opinion, like it's the first time watch which is important. भाई कोई चीज अगर मुझे ध्यान से सुनी नहीं है तो उसको 2 बार 3 बार सुनने का कोई मतलब नहीं है. मैंने बोला एक बार ही सुनो, ध्यान से सुनो, so that you are able to do this. No, doctor, we are having a separate program for NEET PG that will be made available very soon because the FMG result came before. So this program was lined up in accordance with that. And the NEET PG result came subsequently. So we are lining up a similar kind of a program that I'll be conducting we'll be conducting a separate program for the same as well. Now, a query that will come up is like, will it clash with the routine mock test? So no, this is a totally separate schedule, guys. You are getting more match practice because when you're giving a mock test, there is nobody guiding you, right? You're just seeing whether the answer is correct or not. But here it is like, that I would not say hand holding. It is that guidance that towards the right answer. I mean, your eyes will go to the correct answer. That is of primary importance. And like all the MCQs or majority of MCQs will be new questions. That's one of the highlight that I would like to say, that I will not be giving you old questions or PYQs. And it's not like कि ये question आया था और इसका answer ये है. So it's mostly going to be new questions that will test your mind, it will test your reasoning, it will test your presence of mind. So that is what is happening now. Every time you go into the paper, it is a new question, it is a new clinical stem. I mean, the stem of the question evaluation is most important. And then you are also noticing that in the current pattern of the exam, there are long options which are given in the paper, and these long options take one hell long amount of time to read. Even if you are very good at English, it will take you 25-30 seconds to read a question, 30 seconds to read option, 1 minute is gone. So I will make you practice that how to analyze those long options in a much more, I would say, rapid fashion. And the difficulty level will be same as the real FMG exam. In fact, like a lot of people said FMG exam was easy. In reality, it is not, guys. I took a mock discussion subsequently. I discussed about 275 MCQs. There were some repetitions also, so I'm subtracting them. You can go to YouTube, listen to the PrepLadder recall, not by the entire team, but I've done a separate recall as well. In that, I have solved about 275 MCQs after the repetitions have been minimized. In that 275, check out how many of those you got right. And like you will notice a lot of twists coming in the questions, which you will realize that they were actually, maybe you thought that this was an answer to a question, but my answer was different from what the routine answers were. Not because I changed the question, because when I spoke to those people who got the 200 plus marks, they said ki sir, ye to question hi nahi tha. So the most important thing is like it's gonna stimulate the real FMG exam at the moment. And then subsequently, like what we will do is, that blocks would set in mental blocks. So it's like a practice. And then the most important thing would be that after the discussion, you will get the PDF also, my annotations also. Lot of guys, they simply, keep the PDF in your mobile. भाई तुम्हारे मोबाइल में इतने PDF हैं, तेरा PDF सेव करके नहीं रखना. Make it whatever I am teaching you in that answers to a question. There's gonna be questions with explanation, right? So those would be like 4 points, 5 points per MCQ on a particular topic. You have to note them in your own handwriting. जब आप लिखते हो ना तो याद ज्यादा होता है. आपने सुना, आपने देखा और फिर आपने उसको लिख लिया. जो मिस हो जाएगा PDF से देख लेना, but try to make your own handwriting, keep a separate register for that, and I think that it would be much more easier for you to solve it and be applying it. And then another query that is coming up is like, can I ask my doubts? Yeah, obviously the chat, the live chat will be there, and there's like a dedicated group that will be conducting in which you can put your queries for various questions, not only the ones that I've discussed, but suppose you're doing it from an app, whichever, and you say कि sir इसका question का answer क्या है या ये answer क्यों है. So though I keep on getting my emails on my, I'll just put in my email ID at the moment also. That is, if you have any queries with respect to academics only, right? I mean, don't spam me with like how to join, guys. That is already there in the app, or like you can connect with the PL team at any point of time. But yeah, in my email, like the academic doubts, you can come in कि sir ये question का answer ये वाला क्यों है. So I'll answer you in the shortest possible time with respect to the logic and the rationale behind it. That's the most important thing, guys. That's the most important thing. Yes, I'll be taking all the sessions. That is important. Mnemonics, I am not a big fan of mnemonics, as you can see even in my routine discussions. I tend to go more on concepts. I focus more on memory hacks. I'll tell you like, okay, this is the rationale behind it. So I think ये जो सबसे इंपॉर्टेंट चीज है, सो डॉक्टर ऑल्सो यार जब केस आता है तो वो भी तो हमसे यही पूछता है ना यार ये डिजीज क्यों हो गया. So for me to be able to look into the eyes of the patient and tell him that ये disease क्यों हुआ, I need to have clarity myself. So I think the rationale is the most important thing that is applicable for any doctor per se, because nowadays it's the world of perplexity and chat GPT. And patient can put his symptoms in chat GPT. It can also give him a list of differential diagnosis, and patients will come up with fancy terms before you. So if I have to be comfortable, I'm not saying AI will replace doctors. It can never replace doctors. But we as doctors have to be a step ahead of what ChatGPT or Perplexity can do. It is just that we have to be more tech savvy. That is one. And if we read our notes, if we read our books properly, if we know the rationale behind why a particular intervention needs to be done, I'll just give a small example. Like there were a couple of guys from NAD, a couple of guys, NEET PG, they were saying like, okay, if I get into questions, then it will become a little offbeat for today. I'll refrain myself from that, because then I'll go on and on discussing the question aspect, and let's keep that to rest, because already like you are already have gone through the stress of listening to recalls, and because the answers are not matching, so I'll not get into it. But like I was saying, that the memory hacks is what I'll be focusing on, and the analysis of the of whatever the test is conducted, it will be after the test submission. You will also get subtopic wise analysis. Like let's say medicine, you might be good in GIE, you might be good in rheumat, but you might be faltering in cardio and neurology. So you will get topic level insights that okay, this is weak of yours. And let me say, if I look at January, I was solving the paper because we would be releasing FMG solutions book also very soon. So like I was solving the questions in medicine. There were 10 questions in cardiology, man. I was shocked, I mean, all the valvular lesions, mitral stenosis, Graham-Steele murmur, there were 10 questions on cardiology, man. They can make and break a career. So lots of time people tend to skip that. People tend to skip neurology component. So you have to get those topic wise insights here. Okay. And then you have to do repeated listening of these discussions so that you can cross the 75% mark. And we will be doing it, doctor, for NEET PG and INI-CET. We'll be doing it subsequently, as I said. But at the moment, like because the FMG result came earlier, so this is the initial plan that we'll be doing. Now, as far as ranking, etc. is concerned, that is secondary, or I would say inconsequential. What is most important is that you will be able to see your graph. No, I mean, what happens is, I just like COVID की बात हो रही है ना, तो COVID में क्या हो रहा था कि हम कह रहे थे flatten the curve, वैसे ही मैं अभी बोल रहा हूँ uplift the curve. Some subjects of yours might be good and some subjects of yours might be bad, and those bad subjects, like let me say anatomy, biochemistry, physiology, sabhi logo ka bad hota hai for any particular exam. So we need to uplift these weak parts. We need to uplift these weak subjects so that we are able to get the threshold beyond 150. See, you are supposed to get 150 only. That is okay. That is the basic qualifying mark. But then take it on yourself. Take it on your ego कि भाई मैं 150 पे थोड़ी ना रुक जाऊंगा. There will be lot of people जो आपको बोलेंगे अरे यार 12 सब्जेक्ट कर लो, 150 तक की तो लाना है. I am saying भाई सारे 19 करवाऊंगा. But then at the same time you need to put your heart and soul into it. I mean, I want you that okay, comment in the chat box if you're ready for like that challenge, right? The challenge is पूरी जान लगा देंगे. आई मीन शो मी दैट वट एवर यू गॉट राइट इन नेक्स्ट 4 months. आई मीन जितनी तुम में ताकत है, जितना तुम में स्टैमिना है, जितना तुम में कैपेसिटी है, यू नीड टू जस्ट show me that. I mean, obviously doctors are not supposed to have big muscles, as I say. Doctors are supposed to have cerebral power. So here we are trying to, what I mean by flattening the curve is rather upgrade the curve. Upgrade the curve means that all the weak subjects will be made relatively small, much more stronger over a period of time. Now, obviously, like it is not a sole source for preparation. You have to read the theory. I mean, the most important thing is कि theory तो पढ़ना है. अब जो theory आप एक बार पढ़ लिए तो lots of time, let's be honest, and this is one of the very important things that I'm saying. Suppose you say, sir, I read the theory but मेरे question नहीं बन रहे. That means that possibly your theory source may not be good enough or you are not able to apply it. There can be two possibilities. Lots of time, like in biochemistry, we tend to read only carbohydrate and proteins. Most people don't even read proteins and nucleic acid. Carbohydrate में ही 2 दिन लग जाते हैं physical coaching में. हंसी मजाक भी चल रहा होता है उसमें. यहाँ पे तो हम नहीं करेंगे हंसी मजाक, right? Career is at stake. So most guys are just playing wholly in that notes of doing that carbohydrate metabolism again and again. आप इस बार का FMG का पेपर सुन लो, मुझे बता दो कितने कार्बोहाइड्रेट मेटाबॉलिज्म के क्वेश्चन थे, और जो था भी ना उसका आंसर वॉन गियर के नहीं था. Now I'll not get into that question because that is what we'll do on a separate academics pay. But then, like those days when they used to answer only Gotchers and only von Gerke's disease are gone, right? I mean, the twist, a subtle twist in the question. So biochemistry is like make and break. So you might have to see that is your source adequate or not adequate. I know a lot of people will say use the same source, don't change your source. Agreed, don't change your source यार, but at the same time at least analyze तो करो कि उससे तुम्हारे questions बन रहे हैं या नहीं बन रहे हैं. Because अगर मान लो मैं example बोल रहा हूँ, in your physical coaching you are given like 40 pages of a particular subject, 40, right? I'll say example. Out of that 40, if I'm not able to get the questions sufficiently, that means I have to add bulk to it, no? So the adding bulk to it would mean like maybe my amino acid metabolism is not good enough or my nucleic acid metabolism is not good enough. So I have to upgrade that. So you have to make your theory plus plus. That comes with practice. I'll guide you, you know, like I'll keep on telling you the subtopics which you have to basically prepare. And on basis of that, you will be able to, yeah, that's the ego crusher, man. That 147, I know how hard it is. I have spoken to people in real time where people have cried in front of me saying that I deserve it, man. I mean, just 2 marks, just 3 marks. I understand. I understand your pain. But at the moment, my job is to tell you that जो हो गया, right? We need to focus on what can be done subsequently. अब के जो अगले के 4 महीने हम ये नहीं सोचेंगे. We have to build, man. We have to build. So दो चीजें जो हैं, they are like very important, guys. The theory part has to be upgraded. We have to build ourselves. That building part means learning new concepts every single day. A lot of people will say नया चीज मत पढ़ो. अरे भाई टॉपिक इंपॉर्टेंट है तो नया चीज सीखेंगे ना यार. Make it a habit to read one new topic every single day, and then yeah, अगर आपको रोना है तो आज रो लो भाई. If today, if you say that I feel like crying, man, cry today. But from tomorrow or day after, it's not gonna be crying. And you will not say this again that I got this much. I want you to keep the pain with you. So that when you're studying, it is pinching you. No, I need to put that extra hour. रात को 3 बजे 4 बजे जब नींद आ रही होती है and you say no man I wanna sleep, and you leave your books and you go to sleep, that is when that should say no man I'm gonna put my best effort. So if you wanna cry, not an issue, but it has to be one day, it has to be 2 days, from the third day, from the fourth day. Now it's like more than a week, right? So I can say at this moment you need to pick yourself up. I'm there to support you in a sense that I can say okay man, this is a part and parcel of life. I've seen so many people who maybe could not clear in the first attempt, but their practices today are rocking. I had one girl, she cleared in the 10th attempt, man. But she was persistent and she's doing a rocking practice in Patna. So it does not matter, right? Your communication skills, practice is a total different ball game. तरुण जी, अभी थर्ड ईयर में आप T&D के बारे में मत सोचो, अभी आप थ्योरी को कर लो. आई थिंक इफ यू कैन गो थ्रू द मेन वीडियोस ऑफ PrepLadder app, I think they'll be more than sufficient. So if you follow this plan, guys, I can assure you 2 revisions. There will be people who will say 5 revision, 6 revision, 7 revision. मैं कह रहा हूँ 2 अच्छे से कर लो. One is gonna be that entire circle that I'll be completing with you for all the subjects. And then we do it like much more faster where we'll do mock tests also. So you would be, before you go for the second week of January, I mean that January 2026, the second week is the date of the exam. Before that, I want you to do 2 good solid revisions. हाँ जी, वो इंग्लिश और हिंदी में ही होगा ना यार. अब जब भाषा हमारी वही है तो फिर उसी को फॉलो करेंगे ना. पेपर इंग्लिश में होता है, पेपर इज नॉट इन हिंदी. नोबडी सिंप्लीफाइंग द आंसर. सो क्वेश्चंस हम इंग्लिश में डिस्कस करेंगे. द एक्सप्लेनेशन पार्ट is what is going to be in a bilingual mode, English as well as Hindi. See, the biggest problem is paper is in hardcore British English. Hardcore जो accented British English होती है, that is how they're conducting the paper. People are missing words there. So the questions are gonna be in a similar format only. We need to train our mind. भाई मैं भी हिंदी मीडियम से था, मैंने भी अंग्रेजी सीखी, आप भी सीख लोगे, धीरे धीरे सब कुछ हो जाएगा. ओके जी. If you miss a test, there would be no issues. Obviously, you can listen to the recording, but as I said, it does not matter. And then this live and discussion, this is live, guys. This is not recorded. I just want to highlight this once again. This would be live sessions that I'll be conducting in the PrepLadder app only, and they'll help you understand the nitty-gritties of the multiple choice questions. No, I would not suggest you to join at if you're planning for 2027. If you're planning for 26 exam, that yes. So guys, with this, I think I can end this today's discussion and say that if you feel that this would be worth joining, that yes, thank you so much. You can join the program. Otherwise, you can wait for a while, make up your mind, look at all the options that are available before you खुद से पढ़ के देखो. अगर आप अच्छे से पढ़ पा रहे हो, then you don't need to do anything. There is everything available on Telegram and on YouTube. YouTube, I think Elon Musk said that nowadays nobody needs to go to a university. Everything is available on YouTube. There are so many videos available on YouTube that I can assure you that if you just make use of those YouTube videos, now somebody can get very, very decent scores. It is just that if you are able to do it by yourself. It is that if it is not possible in next 1 week, maybe 10 days, evaluate. By the end of August, अगर आप ये बोलते हो कि मेरी पढ़ाई शुरू नहीं हुई है, I'm not able to figure out what to do, then this is the way forward. So thank you so much, guys. We'll be seeing you live in the app subsequently. Take care. Bye-bye.